Chairman, and many of you know I was a practicing cardiovascular and thoracic surgeon for 15 years prior to coming here, and this is one of the issues that got me to come here. Because I have a big concern, as we all do, basically at the end of the day about our patient, and that's what this is all about. Everything we discuss today needs to be framed in the context of how we can better take care of patients, I think that's what I try to do. I've supported outside pay-fors outside of the healthcare sector to try to address the SGR historically. And by the way, I did submit all my cases to the STS database, and I think the STS database is really on the forefront of quality analysis, and it does definitely, I can tell you from personal experience, direct where you practice how you practice your medicine. I always compared myself to my peers and saw how things were going and tried to do everything I could to improve the quality of the care that I offered. The other thing is, briefly, we also, in addition to SGR, we clearly need to address overall health care costs. One of the ways to help Medicare, of course, is have the cost of health care come down, and we need more, I think, as the STS database, attests quality information as well as price transparency for the consumer, which is a huge problem in my estimation, as well as tort reform, which has been discussed, and there's a laundry list of other things that can help us get the overall cost of health care down. Dr. McEnany, I'm going to ask you about the AARP as well as the AHA have submitted ideas on the pay-fors for SGR, and historically the AMA has supported repealing the SGR without pay-fors. We can really use your help, your organization's help in offering pay-fors. Can the AMA offer some substantial possible pay-fors for us to look at to help us repeal the SGR?
Thank you very much for that question. It is a very difficult one because within the healthcare sector, so many people are struggling now just to keep their doors open to their patients, that for us from within the healthcare sector to really come up with a specific pay-for may not be as useful until there are some guidelines set up by Congress on what are the rules of this particular budgetary process. How do we fit those things within that? I think the AMA stands ready to assist and help by weighing in on any given suggestions, but I think we're very uneasy and feel that we don't really have the ability to give you specific pay-fors. The devil in this is all very much in the details. So
the reason I say that is because I think it is important that you really seriously consider offering some options. And the reason I say that is because in the public's mind, okay, the support of the AMA on an issue, for better or for worse, is often used as a up or down on something related to health care. And you know this as well as I do.
right.
Because if the AMA, for example, offered pay-fors, around the country, when this discussion comes up, it will list in there, and the AMA supported this. If the AMA is not there and the AMA doesn't comment, then it's going to say, well, we asked the AMA and they didn't respond to our request. And so it appears that the AMA may not be supporting that. You understand what I'm saying? And what it's used for is it's used politically. It's political. It's a political way to, if something is not tenable to certain groups, to use the AMA's up or down support on an issue as the reason for why it's not happening. And so I would just implore you to really reconsider that, the AMA to reconsider and maybe help us rather than waiting, for other options and then coming out and saying, well, up or down, we disagree or we agree. I mean, I think in all of our lives, right, if you're gonna offer an opinion at the end, then you should be part of the offering solutions on the front side, because in fairness, I think, whether it's within your own family or whether it's to solve this problem, if you're just going to wait and be a critic, then and not offer solutions yourself, to me that's not very helpful. So with the remaining 18 seconds, just please reconsider and really try to really help us. You can help us with this problem with offering solutions. Mr. Chairman, I yield back.
Thank you. The gentleman yields back. Mr.